living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
If you were having a heart attack, would you know the symptoms? You might think they would be obvious, but the warning signs can be different for different people, especially between men and women. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we'll have a heart-to-heart about cardiovascular health with a focus on women's heart health. Stay tuned, we'll be right back after these messages. Welcome back. Heart disease can present differently in different people and differently in women than it does in men. This can be dangerous for people when they don't recognize what's happening or when they put off getting treatment. Joining us first this morning is Betty Reed, who had a heart attack a year ago in August and who also happens to be my mom. Thanks for being here, Mom.
Hi, Beth.
So let's start out by talking about the heart health issues that run in our family. So both Grandma and Grandpa had heart health issues. Can you talk about your mom and dad a little bit?
The heart problems go back in generations for years and years and years. And my dad was really quite young when he started having his issues. He was in his 40s. And had his first heart attack at 45. My mom had two bypass surgeries, 16 years apart. And my dad died in 1980 at the age of 65. My mom died in 2009 at the age of 84. And the biggest thing that I see and the difference in that was the amount of changes in medicine that were able to stretch her life a little bit longer than his.
And you saw Grandpa have heart attacks.
We were at the house when he had a couple of them, and his were, there was the pain and the sweating and, the weakness, but that wasn't anything that showed up when mine appeared.
Yeah, and we'll talk about that in a second. But he had the chest pain and some of those more typical symptoms that you would think of heart attacks.
Yeah, the definite sweating.
Okay, and so then you started having heart health issues. So when did that start for you?
Well, I was put on blood pressure medicine in my 40s. And my first stents were put in when I was 55. We had, where I was working at the time, I had to go up a long flight of stairs. And by the time I got to the top, I couldn't breathe. And so I called the doctor. They said, come in for an EKG. And they sent me right to the hospital. And in no time at all, I was in the cath lab.
And so Grandma and Grandpa both had heart issues. And as you said, it goes back for a ways. You had already had some heart health issues. But then about a year ago, this past summer, that's when you had issues where you weren't feeling well. But can you take us back to that night and what happened there?
Dad and I had gone out to dinner, and a lot of the symptoms would always kind of come forward after a dinner. And I figured I'd just eat too much, of course. But so that was where the heartburn business came in. So that we had gone out to dinner and we were home, and I just was not feeling well. And I started doing everything I could think of that would take care of the heartburn, and it just nothing was really taking care of it. And so I sometimes if I just spread out on the floor, so I just laid down on the floor, and then when I tried to get back up into the chair, things did not go well. So I had always told your dad that unless I can walk out of here, don't you ever call an ambulance. So he didn't even think twice. He picked up the phone and called 911, and we don't live that far from them for where they keep their station. So it wasn't too long and they were at the house.
Okay, and so then what happened when they got there?
They came in, and first thing they did was hook me up to an EKG and just kind of check all my symptoms and all my vitals. And none of the sweating was there like with my dad. And I kept convincing myself that it was heartburn. It was all along it was heartburn. But when they came in, and they said, after they saw the EKG, then they talked amongst themselves and decided that we were on our way to the hospital. So they put me in this fancy dandy chair and hauled me out to the ambulance.
And you said too, in addition to the heartburn, you were having a really bad stomach ache that went into your back.
Yeah, the pain was on the top of my stomach and went around to the middle of my back.
Okay.
But sometimes just a little pressure on my stomach would kind of relieve that. But there wasn't anything that I could do that night that made things any better.
So you got to the hospital, and then what happened?
Okay, well, they zipped me through the emergency room very quickly. And I was in the cath lab before you knew it. And they were talking, saying that this was, that definitely, the people in the ambulance did too, that they kept trying to give me nitro. And I had some issues with that earlier in my heart history that made my blood pressure bottom out. So I was a little worried about doing it at this little teeny tiny little room on wheels, but they did do it, and it took the pain away somewhat, but it didn't get rid of it. So when I got to the hospital, I was still having some discomfort, but it didn't take them long to get me ready to go and get me in the cath lab.
So at what point did you finally realize that this is not just a stomach ache, this isn't just heartburn, this was a heart attack?
I kept trying to convince the doctor that it was heartburn. But as we left the cath lab, so I said something about my heartburn, and he goes, "No, this was the real thing this time." And I have a number of stents, and he said there's probably no room for any more. So the next time, he said it's the big show next time.
Yeah. So looking back now and remembering what that was really like, that it was different than other stomach aches you've had, what advice would you give to people who may be suffering the same kind of symptoms, whether it's a man or a woman? What would you say to them if they know they have a history of heart issues and in their family as well as in their own life?
Well, my first thought, and I think other people too, is that when you're at home and you're not feeling well, we all avoid having to take a trip to the hospital, especially in an ambulance with the sirens and the lights going.
Right.
But we just kind of, don't wait too long. Bob finally said, we better call for help. Mm-hmm. But the only thing I can think of is just, I waited a long time. I really did. I could have been in some bigger trouble if I hadn't. But, if all those antacids and things don't take care of that pain, that I had, you just need to get on your way and pay more attention to what your body's trying to tell you.
Good. Better safe than sorry.
That's right.
Okay. Thanks very much. All right, we need to take a break. But we've heard just how confusing a heart attack can be for some people. Coming up next, we'll hear from a doctor about the differences when it comes to heart disease and what could be life-saving information. Stay with us. We'll be right back after these messages. Welcome back. Heart disease is the leading cause of death in both men and women, but heart disease has traditionally been thought of as a man's disease, even though across this country it continues to be women's most serious health threat. Joining us now is Dr. Chris Godlewski. Thanks so much for being here, doctor.
Thank you.
So how can heart disease present itself differently between men and women?
Well, there is a common perception that women present with a different set of symptoms of heart disease in comparison to men. And whereas there are some differences, to me, I think more important are the similarities. And what you mentioned in your introduction, the fact that heart disease remains the leading cause of health problem for women, both in terms of threat to their lives as well as the quality of life. We have to remember that it's a disease both of men and women, and generally the presentation is very similar. There are subtle differences which are mostly unexplained. The reason why it is that women present somewhat differently than men is not entirely clear. Okay. One of the differences perhaps is that women tend to present at an older age. commonly it is said that women generally are about 10 years older at the time when they present with heart problems. So older people, diabetics, people with high blood pressure, tend to have somewhat atypical presentation. So that what typically is described as a presentation of a heart attack or coronary disease is chest pain. You know, central chest pain, which is crushing pressure and so forth. And women also present with those symptoms. But at times, you see, especially in older diabetic patients, atypical presentation, like for instance nausea, like for instance belching, vomiting, sense of profound weakness, sweating, and so forth. Sometimes even older patients, there is changes in mental status, like for instance confusion and so forth. So it becomes kind of nuanced to discern those symptoms, because other diseases can present with similar problems. For instance, the epigastric pain right here in the pit of the stomach can be a sign of a heart attack, but it also can be a sign of gallbladder disease. So it requires attention, especially from the first contact physician or emergency doctors or even paramedics, to be aware of the fact that certain symptoms which are not classically described as, you know, crushing chest pain, angina, and heart attack, that they also may be a sign of an ongoing heart disease.
Okay. Can you explain exactly what happens when a person has a heart attack? What's going on with your heart?
So the heart attack is a part of the spectrum of diseases called coronary heart disease, and heart attack and related problems fall under the category of a unstable coronary or acute coronary disease. The problem is the blood supply to heart muscle. So the heart requires oxygen and nutrients to perform the work. The heart works constantly. It's a muscle that works without stoppage, right? So it constantly needs to receive supply of energy and oxygen. So it has its own set of blood vessels that supply oxygen to it. So the blood that's inside the heart is getting pumped around the body, and the heart is unable to use this blood for its own needs, so it has its own set of blood vessels. When one of these blood vessels becomes clogged up by clot or by plaque, that's when you start having problems with the supply of blood flow into the heart muscle, and it can manifest itself as chest pain, angina, or if the blood supply stops completely, that creates a situation of a heart attack. And that in turn causes symptoms, which we talked about, either typical or atypical, and ultimately, if it's not remedied, can lead to permanent damage to the heart muscle.
And so you did talk about the symptoms earlier about a heart attack. Sometimes we hear this term silent heart attack. What is that?
So some people are diagnosed with an old heart attack without ever being aware of the problem. Some of those are truly silent, where people have just no symptoms whatsoever, and later on examination, they are found to have electrocardiographic changes or detectable damage to the heart muscle. Sometimes they have symptoms which they don't identify as a heart attack. So for instance, somebody has flu-like symptoms, or their shoulder hurts, or they have 2 or 3 days where just don't feel well, or have nausea and they think they have a stomach problem. And then later on it turns out that likely this was the moment when they had a heart attack, and they simply ignored it in the sense that they didn't recognize it as a heart problem. There's always something different.
So we're just about out of time before we need to take a break, but just really quickly, if those symptoms are more subtle than that chest pain that you talked about, does that mean it's less damaging or less dangerous than when you do have that chest pain?
Not at all. There is really no difference in terms of the danger to a person's health. And that's the difficulty in cardiology, the variety of symptoms, and the fact that sometimes those symptoms are not alarming to a person who perceives them.
Okay, and then just one final question, as far as if you are having a heart attack, or you're not sure if you're having a heart attack, what should you do?
You should call for help. there really should not be any hesitation, because there really is no time to waste, because the damage that can be done to the heart is irreversible. So you really don't have a second chance. You cannot wait a day or even hours to see how it turns out. If you are in doubt, you should call for help right away.
Okay, perfect. Thank you so much, doctor. We do need to pause for a quick break here. But coming up next, what are the risk factors when it comes to heart disease, heart attack, and other heart failure? And are they different for men and women? We'll talk about that when we come back. Stay with us. Thanks for staying with us. Many things can put you at risk for heart health issues. Some you can control and some you can't. But knowing how to talk with your doctor and understanding your personal health risk factors could be life-saving. Dr. Chris Godlewski is still with us to share some expert advice, so thanks for staying around. So are women at a greater risk for heart attack or cardiac health issues compared to men?
They are not. They are about the same. Actually, there may be slight preponderance of risk in disfavor of men in terms of heart attacks and coronary heart disease. Women tend to be at somewhat higher risk for heart failure, especially at the older age, and especially one particular type of heart failure for which women have a higher preponderance.
And so we've mentioned age. Why is age a risk factor when it comes to your heart health?
Well, so age is the risk factor in terms of every disease. You know, the older we get, the more health problems we tend to have. You know, childhood has its own diseases, early adulthood has its own set of diseases, and the older age has its own. So, you know, of all the risk factors for any disease, really, the age is consistently the most important risk factor. And of course, we cannot change our age, but we have to be prepared for it. We have to be able to address it and anticipate those changes as we progress through the years of our lives.
So as we get older, should we automatically be talking with our doctors about our risk for health issues when it comes to our heart?
Yes, but we should actually talk about it since the early age, because the risk for heart disease at old age is a result of accumulation of the risk factors throughout the lifespan. So it really starts with the childhood, with what we learn about to go about our daily living that can ultimately result in health problems in a later age. So identification of certain diseases, like common diseases, you know, which people tend to ignore perhaps, or not pay enough attention, like high blood pressure. High blood pressure starts at an early age. Usually teens and 20s, you have some inkling that a person may be at risk for high blood pressure, and that accumulates over the years, and over time it may result in all kinds of problems, including heart attacks, strokes, heart failure, and so forth. Diabetes is a disease which also can be identified at earlier ages and creates a risk in later life. And also, you know, the lifestyles. You know, unfortunately, we're dealing here in the United States with an epidemic of obesity, which is a very complicated problem. One of the components of this problem is the way we go about our daily life. You know, the inactivity in our life, physical inactivity, type of nutrition we get, and so forth. So those things can be addressed throughout the course of the life. At a later age, you know, in the middle age, in people who are in the middle years and older, this should be addressed with your physician and should be discussed, and remedies should be taken. Okay,
so age, diabetes, obesity, high blood pressure. How do you talk with your doctor if you're concerned about your risk for heart health? Do you have any advice on how to start that conversation?
I think this is very individual, but you know, people who are at risk, who have certain underlying health problems, like for instance diabetics, like for instance people with high blood pressure, should be aware that those things have far-reaching ramifications. And that you know, with the diabetes, the control of sugar is not a goal in itself, but it has its own ramifications later on. That taking preventive measures to remedy the risk factors for diabetes have ramifications. Unfortunately, there is no single recipe for how to address it. It's very individual. I think that everybody should be aware, however, that these problems are very common, and they have to be remedied if we want to avoid consequences in our later life.
Can you talk about some of the more common tests that a person might go through if there is a concern for heart health issues?
So there is no single test.
Okay.
History, telling your doctor about how you feel about your symptoms, checking basic things like blood pressure, checking basic labs, checking cholesterol levels. Those are the kind of common sense tests that can be helpful in structuring the plan for health maintenance in the future. Unfortunately, there really isn't a practical way to detect somebody who does or does not for sure have coronary disease. Now, there are tests, of course, we do them, but the way they work is such that they are not suitable, not practical to apply to the population. There is a screening for heart disease. So we really have to operate in the world of identifying risk factors, realizing the risk factors, and modifying them.
Okay.
It is really always I want to say game, but it's not a game really, but it's a matter of understanding the probabilities of risk and affecting those probabilities by modifying the risk.
Okay. And we were talking before the show about heart disease, heart health issues, heart failure, and these all have some subtle differences. Can you talk specifically about heart failure and what that is?
So heart failure is a very complicated area. The heart failure is kind of a catch-all term that encompasses multitude of heart diseases and heart problems. In terms of women, there's one type of heart failure which is called heart failure with preserved ejection fraction. Long name. Essentially what it means is that when you look at the structure of the heart and function of the heart, it seems to be normal. In other words, the muscle appears to contract fairly normally, and yet the person develops symptoms of heart failure, as opposed to heart failure in which muscle is weak and doesn't contract properly. Unfortunately, whether the muscle is weak or not weak, we have heart failure, the prognosis is just as bad. It is a dangerous disease. It's a disease that affects the quality of life and which also shortens the lifespan quite a bit. And the problem with the heart failure with preserved ejection fraction is that, first of all, women are much more, at much higher risk than men, 3 to 1. Okay. So women are at higher risk for heart failure with preserved ejection fraction, and there isn't really a very effective way to treat it with medication. Just medical treatment doesn't work very well for it, and the only thing that works seems very simple, meaning proper diet and exercise. Unfortunately, that's very difficult to implement.
Sure. Okay. Well, we're out of time, so we do need to go, but thank you so much for all your information and your expertise. We appreciate you being here. Bottom line, though, is try to eat well, get some exercise, and talk with your doctor. Okay,
yes,
perfect.
Thank you.
And thank you for being with us today. We hope you'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.